Alzheimer's disease. A progressive neurodegenerative disease characterized by a loss of function and death of nerve cells in several areas of the brain. You lose the ability to suck and swallow, cause of death, can't eat anymore. Multiple sclerosis. It is progressive, will get worse. A disease of the central nervous system. It is an autoimmune disorder. Our own immune system is attacking cells, oligodendrocytes. Immune system forgets about the CAMs. Starts attacking different cells in the body. Parkinson disease. A slowly progressive degenerative neurological disease affecting the basal ganglia, a progressive disease that gets worse and worse, that's caused by too little dopamine with tremors and a mask-like face, you can't control muscles. Estrogen protects women from Parkinson's. Ataxia, loss of motor coordination. No cure. Stroke, it is a neurological impairment caused by a disruption in blood supply to a region of the brain, suddenly happens, sudden onset. Two main types of strokes. Cerebral hemorrhage, bleeding in the brain, happens when a blood vessel ruptures, all the blood seeps out and moves into the neural tissue of the brain. Cerebral ischemia is a blockage of blood supply to the brain. Cerebral aneurysm is a bulge or balloon-like dilatation swelling of a blood vessel in the brain, disruption of blood supply to an area of the brain. Embolism, obstruction of an artery, typically by a clot of blood or an air bubble. A concussion is a temporary loss of neurologic function with no apparent structural damage lasting for a few seconds to few minutes. Jarring of the brain that caused it to stop functioning momentarily. 2. A contusion is more severe injury in which the brain is bruised, with possible surface hemorrhage. Unconscious for more than a few seconds or minutes. Picture is somewhat similar to that of shock. Patient HM went through a bilateral medial temporal lobe lobectomy. Patient HM, Brian regions removed in surgery, hippocampus, amygdala. Causes of brain damage. Brain tumors. Cerebrovascular disorders. Close-headed injuries. Infections of the brain. Neurotoxins. Genetic factors. Types of brain tumors. 1. Meningiomas, 20%. Encapsulated tumor. Benign tumors. 2. Infiltrating tumors. Malignant, have cells that grow uncontrollably and spread locally and or to distant sites. Metastatic tumor, tumors that originate in one organ and move spread to another, didn't originate in the brain. The lungs are the most common metastatic tumor.